Hey friends, this is Malki Assad and welcome to this special video in which I will tell you all the secrets and all the details that you need to know if you want to start residency in the UK. Today I have a special guest, Dr. Ibrahim Antoun, who's going to tell us about his journey to starting residency in UK, and he's interested in cardiology and he's going to pursue that after his internal medicine residency. Ibrahim, can you start by introducing yourself to our viewers?
Hi, Malki. Thank you for having you on the channel. My name is Ibrahim Antoun. I'm one of the year 2 resident doctors in Leicester, UK. I'm starting my year 3 in a few months' time, and I'm hoping to pursue a career in cardiology in the UK. And I'm finishing up my PhD in cardiology as well.
Awesome. I want to start by asking you about the exams required for starting residency in the UK.
So the first thing you need to do is to prove your English proficiency. And by doing that, you need to do either 2 exams, either the IELTS exam, which is known to everyone, and the OET exam, which is the Occupational English Language exam, which is approved by the ECFMG as well.
Specific scores on these exams?
Yes. So in the IELTS, you need to get 7.5 overall and 7 in each category, which is reading, writing, listening, and speaking. So you need to get 7 in each, and you need to get an overall score of 7.5.
I see. What about the OET? Is there a specific score for that?
Yes, it's 350 or B in each category as well.
Awesome. So for IELTS, I assume there are specific resources provided by the company that runs this exam to prepare for it?
Yes. So basically, IELTS is much older than OET, which is newer exam. So for the IELTS, there's like a stimulation exams, which you can do on the computers and things. It's called Cambridge IELTS. It's obviously, you need to purchase them. There are a few versions, and you can do, some sort of exams, and they have CDs and things which you can do, exam, and you can correct yourself and things. But yeah, Cambridge IELTS is the main source that everyone prepares from.
Awesome. For those who are coming to residency in the US, they have the step 1, step 2, which kind of test their medical knowledge. Is there a counterpart of that in the UK?
Yes, of course. So basically, after you do the IELTS or the OET, there are exams called the PLAB, which has 2 parts. Part 1, which is a medical knowledge exam, and part 2, which is a clinical skills exam, which is equivalent to the CS previously. So PLAB 1 is a clinical, is similar to the USMLE step 2 CK. It's not like too basic as step 1. So basically, it's a 3 hours exam, 200 questions, multiple questions. So 3 hours, like I said. The passing score, I think you need to score like 60%, but I think it's scaled, similar to the US scoring system as well. What's good about these exams, that score, having a great score doesn't matter. So as long as you pass, that should be fine, which makes a huge difference in preparation. I mean, as well, when you go to the exam, knowing that you need to score to compete is different than going there, passing is fine. So I think preparing for these exams is a bit more chill than the US exams. Regarding material for the PLAB 1, there's a question bank that's similar to UWorld. It's called PLABable. It's a monthly subscription that has all the questions you need to know. And what I need to advise the people, when you do the questions, always read the explanation, because the explanation might be a project for a new question. So don't just do the questions and that's it. So read carefully every choice. And I think 4 or 5 months should be more than enough to pass the PLAB 1.
I see. So that's a huge difference between the step 1 previously that used to be pass fail scored, and now it's going to be pass fail. So the score does not matter too much. They just need to pass, and the question bank is more than enough to prepare for this.
Yeah, exactly. Assuming that you have basic medical knowledge, obviously, the question bank should be fine.
And can students prepare for this exam or do this exam before they come to the UK?
Yes, they can, but you have to have the IELTS or the OET first. So you cannot register for the PLAB 1 unless that you can prove that you have the correct score. Yeah.
I see. So you can do IELTS and the PLAB 1 while you're outside the UK.
Exactly, in specific centers outside the UK.
What about the second part of the PLAB that is similar to the CS, the clinical skill?
Yeah. So basically, it's an exam that's only takes part in the UK, and it's in the city of Manchester specifically. So even London doesn't have a center. It's only in Manchester, which makes booking the exam quite challenging, based on the low cases and now with the COVID and things. So it's a 6 hours exam, as far as I can remember. It's an 18-station exam. You need to pass 12 stations in order to pass, and you need to have a certain score, which depends on the other, and the mean and the median and the other things that the examiners take. So, multiple stations require history taking, examination skills. Sometimes like they bring you surrogates, so you can kind of do some teaching teach them like ALS, BLS, and examinations and things. So you don't have a viva afterwards. So once you examine the patient or take history, you have 6 minutes and that's it, 8 or 6 minutes. So they give you a ring with the 6 minutes, and then you have 2 more minutes. But then that's it. They judge you, and they give you scores. Again, it's a pass or fail, so scores don't matter as well. So basically, it depends as well. So there are a few parts that they test you on. So there's like clinical judgment and clinical skills and interpersonal skills, like which being polite, manners, speaking respectfully to the patient, respecting the patient, and things. So they test you on these 3 things, and obviously they give you a score, and then you take it from there.
How can students prepare for this exam?
So preparing for this exam is a bit more challenging because you need to be in the UK, because you need to have a feel of the exam. Similar like the US, you can prepare to a certain extent, but then you have to go and prepare in person and practice with other people, because they already tested your knowledge in the PLAB 1. The PLAB 2 is all about clinical skills. The way that people do it here, they go to courses. There are a few courses in the UK. I don't want to mention because I don't want to promote anyone, but there are a few courses in the UK that are there that you can go for. I think they're almost 2 weeks each. They give you some sort of scenarios that you can practice, and you meet a lot of people there. So you spend like 2 weeks practicing with other people, and that should be fine as well. I think 2 months should be more than enough to pass PLAB 2 actually.
Oh, so both the PLAB 1, PLAB 2 probably take around 6 months?
Yeah.
I see. Let's say that somebody completed IELTS, completed PLAB 1, came to the UK and did PLAB 2. Before we go into that, what's the type of visa that people need to go in to the UK to do the PLAB 2?
So basically, it's a visiting visa basically, but you can it's kind of a visiting visa. It's like B1, B2 in the US basically. It's called the visitor visa. They give you the visiting visa, I think, for 6 months, and then you need to obviously you need to prove that you have the exam permit. You need to have a date and things. But yeah, it's a type of visiting visa, basically like B1, B2 compared to the US. Yes.
I see. Let's say somebody, as we asked before, the completed IELTS, PLAB 1, PLAB 2, and now they're in the UK. What do they do next to start residency in the UK? What are the steps that they need to take? How is the residency system works there?
So basically, for you to start residency in the UK, first of all, you need to get a medical license. For you to do that, you need to register in the GMC with the General Medical Council, which is equivalent to the ECFMG in the US. So you have ECFMG in the US and GMC in the UK. So you have to make an application. You have to prove that you completed 12 months of internship. They're really particular about these things. They need to know that you completed 12 months of internship. They need to know that you have, you're in good behavior. You didn't do anything, bad in your country. Once they do all the necessary checks, you pay a fee. It's around 400 UK pounds, and then you get the medical license. And then you can start applying for jobs. For you to start applying for jobs, I think the difference between the US and the UK, I think the UK system is a bit more complex in the sense that not all jobs are residency jobs. Some jobs are just like service provision. So you're working for a fixed term, but you're not in a training program. So you're not progressing, because there are some things that you need to sign off in terms of papers. For example, when you apply for residency, you need to apply for PG1, PGY2, in the US. In the UK, there are 3 sectors. There's foundation training, which is literally straight out of med school. There's core training, which is PG1, PGY2, or CT1, CT2, we call it in the UK. And there's specialty training, which is called fellowship in the US. Foundation training is really tough to get, and there are limited numbers because they prioritize the UK graduates. So basically, for you to bypass the foundation training, you need to prove to the GMC that you are competent basically to do these things that these foundation doctors can do. So basically what you can do, you can take a non-training job for a few months just to sign off these papers from attending/consultants. And then once you sign this paper that says that you're competent enough to do these things, then you can apply for a core training, which is PGY1, PGY2, and then you can kind of bypass the foundation training. So I started in core training, or internal medicine training. So basically I worked for almost 1 year a non-training job, got my papers signed, got my form signed, and then I can apply for the national match for the internal medicine training. And that can happen for every other residency that you can pick.
I see. So there are 2 options: either go through the foundation route, or go through non-training and then go apply to residency.
Exactly. So it's complex, but I think it's a bit flexible actually. So you can kind of pick your battles really.
And why would somebody do 1 year of non-training when they can apply to the foundation year and just do the regular route?
I think the foundation training is very tough to get into. The numbers are very limited. Whether getting a non-training job is much easier because, I mean, we have a lot of vacancies, we have a lot of rota gaps and things. So it's easier to get a non-training job and then apply for the actual core training.
So for the foundation years, do you have like a match process like the US, or it's all around the year?
It's a national process. It's very similar to the US.
I see.
It's a national process.
There is like a match at the beginning of the foundation year, and then you do 2 years of foundation year, right?
Yeah.
Then there's another match that is
exactly
US for the residency.
And there's another match for the specialty training.
So let's go one by one. For the match for the foundation training, and I'm going to ask you about the non-training as well.
Yeah.
What makes you a competitive applicant? Because we said that scores don't matter for the PLAB 1, PLAB 2. If you pass the IELTS over 7.5, so it's not going to make a big difference to your 7.5 or 8. So what do the people who are choosing the applicants care about at that point?
Yeah. So provided that you finish 6 years of med school, you can apply for foundation year 2, because foundation year 1 in the UK is equivalent to an internship. So what you can do, you can apply for foundation training, but you can only do the second year because you can bypass the first year. What makes you a competitive candidate is research. They really care about research. So if you published a few papers, that's really important. They really care about leadership skills and teaching skills. So if you taught some med students, it gives you more points. So they have a points-based system. So if you publish 2 articles, you get max points. If you publish 1 article, you get half points. If you don't publish any articles, you don't get points. If you have a poster in a conference, that gives you more points. And if you had teaching skills, it gives you more points. If you had leadership skills, like you were tutor for students and things, it gives you more points. So the more points you get, the more competitive you are. But yeah, things they care about is mostly research and publications and posters and things. And if you had a distinction for med school as well, that gives you even more points.
So there is a point system for applying.
Exactly.
Yeah. Are you able to send me the link of that so we can leave it for the?
Of course, I will.
System.
Of course. So once you apply with the point system, they shortlist the people who have the highest scores, and they do interviews, and then they combine the interview score with the shortlisting score, and then they rank.
I see that. That's different. That's different than the US, because in the US they care a lot about the things that you mentioned, the publications, the presentations, volunteering activities, teaching, work experiences. And this is something I always highlight for IMGs, because IMG's mentality is that step 1 score, step 2 score, and they come like Supermans to the match, and they think they'll get 100 interviews because they have 265, but they get shocked because they get 1 or 2 interviews. There are so many other factors that play a role in the match. And if people are interested in research, they can check out our research course, in which I detailed the way and how to get a publication from A to Z. So make sure to check that out. I'll leave the link in the cards about in the description below. But you can have a look at that system, because it's different than the US. In the US, we don't have a point system. We have people assess all these things that you have, and then they decide whether you're worthy for an interview or not. Yeah. But having a point system is interesting.
I think it's more objective, actually. And
I agree. I think that it makes it more objective, decreases the importance of having a personal connection to the person.
Yeah, exactly. So there are having a connection won't help you much because it's a national process. So
I see. Is it the same for the residency, or it's a different system?
It's a similar point system. So the higher you get in your training, the higher they put their emphasis on something. So if you have membership of the Royal College of Physicians, which is American College of Physicians, you get points. It's a must in later stages, but in foundation year they don't care. So I think different types of training, like different types of residency, they have different points, but like there are common grounds such as research, publications, posters, leadership, teaching, distinctions. So those are the main points. And they make it obvious. They tell you, if you don't do these things, you're not going to get points. You're not going to get shortlisted.
Oh, wow.
Yeah. Wow. And you do only 1 interview. So I think in the US, you do interviews with multiple people. In the UK, you do 1 interview and only 1. You get the score, and then you get a certain score, and then you rank your preferences. And they do, so the number 1 person in the UK, what does he want? And then the number 2, and then they go.
Wow. So there is like a ranking on the whole country.
Yeah, like it's a national ranking. So who's the number 1 person in the country? And then he can choose, and then vice versa. And then, you can either accept or reject. And if you reject, your offer will go to the next person. And then the next person's offer will go to the next person. And they'll do a few rounds of this, and then there will be the final offer.
Wow, that's interesting. So for this process, how do IMGs compete compared to UK graduates? Because if you're telling me it's a national system, that means they get mixed. Everyone is ranked in the same system. What are
Exactly.
the chances of IMGs? Are there like what they say discrimination against IMGs, or they don't look at them as they look at UK graduates? How the value of this school of graduation in this process in the point system? Can you tell us about that?
I think the UK medical schools, they know what they work into. So I think they prep them for leadership and things because they know the system. So I think they prep them to match in the system. For an IMG, I think it's a bit more challenging, especially if you want to go for plastic surgery, radiology. It's a bit more challenging. I think it's another reason why doing the non-training job is kind of important. I mean, 1 year you can get your teaching signed, you can get a poster, you can get a publication, you can get a feel of the system and what they want and don't want. I think you can get your things signed, but I think it's not very tough. I think in 1 year you can do a lot of these things. Some people take 2 years, some people take 3 years. It depends on how high you're aiming, really. But once you get in a non-training job, you can either, you can always sign up these things and learn how to do these things like research and things.
Let's say applicant A from Cambridge University with 5 publications, 5 presentations, 5 volunteering, 5 work experiences,
Yep.
Same exact experiences from University of Morocco, 5 publications, 5 citations, 5 experiences. Do they look at them the same, or they say, oh, but this is a UK graduate, this is a Cambridge graduate?
Well, depends on the interview.
I see. So
and obviously the Cambridge,
it's totally different than the US, because in the US, if you're like, there is a big difference in the med school, they might not even invite you if there is an applicant on the same level.
No, in the UK, it's solely based on points. So whether they invite you or not to the interview, it's literally point based. They don't care about what med school you come from. It depends on how much work did you do.
So if you work hard, achieve that point system. If for example, now one of our viewers is in their first year of med school in India or Pakistan or China, and they're listening to this and they start building points through this system, they would be competitive in the match.
Of course, even more than the UK graduates if they work that hard.
Wow, that's amazing. I didn't know that. That's very interesting to hear.
Yeah, it's actually true. So you can get whatever residency you want if you work hard enough. It all depends on how hard you work. But I think the flip side is some people just do it for the points. So some people play the points game and not, so I think there's a thin line between both. I think you need to like it, and I think you need to actually get benefit from it rather than just doing it for the points. But I mean, it's a hard work anyway. So yeah.
Yeah, I'm sure like some people, okay, I need to get a volunteering, so they go for it and do volunteering. Now they have a checkbox, and now next checkbox.
Yeah. Sometimes it becomes a ticking boxing exercise. But I think if you want to aim that high, I think you need to love what you do. Otherwise, you cannot tick all the boxes in a.
And you won't be doing it for a long time, because if you're forced to do something for a short time period, it's not gonna be, it doesn't make the journey fun, which is why we go into medicine. It's a very long route. If you don't enjoy it, probably need to do something.
Yeah, exactly. So let's say for example me, so I got the medical training. So once you get the training, then you're in the system, then there's a progression. And then you have 3 years to kind of work on the other stuff. So I want to be a cardiologist. I see, okay, what does the cardiology people want? They want commitment to specialty. Okay, I want to go to an echo course. I want to publish some papers. I want to finalize my PhD, because you get points for postgraduate degrees. So once you're in the system, you can kind of look forward and say, okay, I need these points. What should I do? So yeah, you can always look forward and plan your points ahead, which is good. So you can plan your application easier than the US, I guess, because you have a completely well-known points-based system.
Yeah, it's more objective. The US is definitely more subjective.
Yeah, agreed.
So we talked about matching into the foundation years, into residency, and fellowship probably is going to be a similar system, points, different bars for different things. Yeah. What about these non-training jobs? How can you get them? How do you apply to them? How can you get a position compared to another applicant? I'm sure there is also some type of competition for that.
Yes, I mean, I think the line is not very clear at this stage. I think there are some websites that you can go to and apply. I think the most common website is NHS Jobs. As you might know, the system in the UK is different than the US. It's a national care system. It's not private insurance companies. So it's a national care system that's funded by the taxpayer and the government. So it's called NHS National Health Service, which is well known all over the UK. So you go to NHS Jobs, and then you can kind of search the role that you want to get into. And obviously they have a criteria, that if you don't have this criteria, like if you don't have 4 years of experience, that you shouldn't apply. And they have a desirable criteria, like if you don't have it, that's fine, but we would like you to have, let's say, MRCPs, and we would like you to have leadership skills. So, and then it's the same old process. You apply, and then they want to interview 5 people, so that they pick up the most suitable 5 people in their opinion. So this is more US like. They pick up what they want, and then they apply you and they give you the job, basically. But it's a fixed term, so they give you only a visa for like 1 or 2 years. So it's it's not the most stable job, but I mean, you have to do what you have to do to sign off your stuff, really. So many people went for it, including me, until I got my things sorted, so I can get the residency. And that should be the aim, the end game goal for everyone, to get the residency.
So it's kind of US clinical experience or some type of research position you get into until you match into residency.
Exactly. Yeah, pretty much.
You mentioned that you did a PhD and you're doing a PhD now. Can you tell us how that is valuable? Why did you do it, and how you get that PhD position in the first place?
Okay, so basically, I had to do a lot of research on the internet, see what topic I like and what things I want to do. I emailed some supervisor. It's pretty much like so email supervisor, like, I'm interested in doing this topic. Would you mind supporting me? And if they say yes, and then you go into applications and things. And if they like you, they give you the job. So PhD, if you want to pursue a career in academia, I mean, a PhD is a must. If you want to do research and things, and you want to be a professor, associate professor, you need to have some sort of postgraduate exposure. From a point system, obviously, going back to the points, you get like a lot of points for a PhD, and from a PhD you can publish, so that's another point. So you can use the PhD for many things. But I think for me, the main goal from the PhD was to maybe pursue a career in academia in the future, actually. So I don't think anyone should do a PhD just because of the points, because you're wasting 3 years of your time. But yeah, doing a PhD is only for research. If you want to pursue a career in research, then it's for you. If you want to do it for the points, then it's not a good idea.
Yeah, definitely. It's a lot of commitment to do a PhD. It takes a lot of time, a lot of energy, and you end up with maybe like one but very big paper. I assume very impactful paper.
Exactly. You end up with a Lancet or New England paper, but I'm not there yet. But I think during the later stages of my PhD, I started my residency because I didn't want to delay it, and then I was doing a PhD and residency at the same time, which is really very tiring. But I think as a doctor, you need to make some sacrifices to achieve what you want. But if you work hard, everything is achievable, and you know this very well because you've been there as well.
Definitely. So for IMGs coming into the US, the biggest challenge is actually their medical school of graduation. This like stigma that sometimes follows them into their fellowship, follows them into their jobs. What is the biggest challenge for IMGs applying to the UK?
You mean working in the UK or getting accepted?
Getting accepted.
Getting accepted, I think the experience. You need to have a lot of experience. I think they look down upon you if you don't have a lot of experience, because sometimes I think first impressions are so big in this country. If you don't make a good first impression, even if you improve later on, this first stigma will still follow you around. I don't think they care much about your school of graduation if you're good enough. I think the biggest challenge is having the experience and the skill set to succeed in the system.
I see. Okay, so now I want to shift gears a little bit. Somebody matched and they're starting their residency. Can you give them an insider review of how residency works in the UK? Because in the US, I know that you start in a hospital and you spend the whole residency in one hospital. I heard it's different in the UK. Can you compare and contrast the two countries regarding where you do your residency after you match?
Yeah, so you're absolutely right. I think in the UK, we have deaneries. So, like certain areas, so Southwest, Southeast, area. So you do, let's say your program is 3 years, for example, like my medical internal medicine training. So you do 1 year in one city, and then another year in another city, and another year in another city. Or you can do 2 years in one city and 1 year in another city. So you rotate across hospitals. And because let's say you're in a tertiary center, big center, you want to go to that small center so you can experience these small cases that you're not going to see in the big center. So basically you do rotations every 4 months. So you have 3 rotations a year in the same city. So you might be in another hospital in the same city, but you do 1 year in the same city, but you can switch between hospitals, and then you can do another year in another city. It's close. It's not that far away because the deanery is not a. Obviously, there are some deaneries that are larger than others, but mostly the deanery is not that big, which composes of, let's say, 4 or 5 cities, and then you can rotate between them really. So it's actually fun, but if you're settling down, if you have family, let's say if you bought a house, it would be a bit challenging actually rotating.
Yeah, because I can't imagine, like I suffered when I moved here. It's like a lot of things that you need to do, insurances, licenses, so many things that you need to take care of.
Yeah.
So I can't imagine doing that every every year. That would be really challenging.
Yeah, like the only time that you really feel stable and when you get a consultant, aka attendee job, and then you can feel, "Oof, I'm stable." But otherwise, you're always rotating around.
Wow. So you mentioned the idea of attending job. Can you compare and contrast a little bit the lifestyle and the income between the UK, let's say with residency and attending between these two countries? Because this is a question I get asked about a lot, and this is important to know for people who want to pursue residency in one country or the other, to see their project their future or career after they finish residency and also during residency. Can you compare the two countries if you have an idea about the UK after you finish residency as well?
I think that's a good question. I think everyone, all the people who are watching are probably wondering about this question. I think when you start, the salary is very similar. So, like it's around £3,000 and £1 is 1.34 US dollars. So it's like, let's say $3,400, $3,500. Obviously, if you live in London, the salary is a bit more because London is very expensive. But you start with like a £3,200 UK pounds, and then it increases, but not by much, like 100, £400, £300. I think the residency salary is very similar between both countries. I think the big difference is when you finish. When you finish residency in the US, your salary, to my best knowledge, it skyrockets. In the UK, it doesn't skyrocket that much. I mean, if you're lucky, you end up earning like 120k UK pounds, 120 UK pounds.
That's interesting. That's like what nurses or some physician assistants make here.
Yeah, exactly. So 120k.
Nurses now are making over 200, 300k a year.
Yeah. And let alone, in the UK, if you earn more than 100k a year, your tax increases to 40%. So imagine you.
Also a big difference because the tax caps at, I think, 35%.
Yeah.
Wow.
So basically, if you're lucky, I mean, the thing is, because it's a national system, you're being paid by the government. You're not getting paid per patient. You're getting paid a set salary. Obviously, in the UK, there is some private work, but I don't think the private work is as big as the US. If you're going to do private work, you earn a lot of money, but you need to be a very well-established attendee or consultant for you to get some private work. So if you're a plastic surgeon, then you're more likely to get a private job. If you're a cardiologist, you're more than welcome. You can, but other specialties, it's very limited. So I think as an attendee in the UK, if you're lucky, you'll get 120, 150. That's before tax. So it's not that much. It's comfortable. You live comfortably. But I don't think you'll get that luxury lifestyle that some US attendees have.
Yes, I agree with that.
but the residency in the US and the UK, the salary is pretty much the same.
I see. What about the lifestyle? I think this is also a good discussion point, because if you're making 300-400k as some physicians or so many physicians in the US make, but you're working so many hours a day, you start thinking, well, do I have the time to spend the money? Do I have time to enjoy the money? So can you give us an idea about how residency lifestyle goes and how the attending lifestyle goes?
Before I answer this question, just going back to the previous question, I mean, as a UK consultant, or, when I say consultant, I mean attendee, you can always work extra hours. If you're not happy with your income, you can always kind of work extra hours, and that will give you a boost, almost sometimes doubling your salary, because the rate for a, attendee is even higher. So you can kind of match. And I'll tell you about the lifestyle and the hours, to get to my question, just so I don't put people off from the UK completely. You can always top up your salary if you're not happy with it, with working extra hours. So going back to this question, I think the residency in the UK is not as intense as the US. It's not intense. It's more time. You spend more time, but it's not as intense. So I'll give you example for me. So my normal working days are 9 to 5. So sometimes I literally can wake up at 8 a.m., which is not the case in the US, I'm assuming. When you do on-calls, you have two types of on-calls. You have a long day, which means from 9 a.m. to 10 p.m., or you have night shift, which is from 9 p.m. to 9 a.m. Yeah. And you only do that for only three days or 4 days, like a streak. And after that, they give you like 2 days off. So when you do like 3 on-calls in a row, you get like 2 days off. And then the next week would be normal working days. So you do on-calls every other week. So 1 week you have the normal 9 to 5 job. And then the other week you'll have on-calls, which is either, 4 days of 12-hour shifts or 3 days of weekend of 12-hour shift. And then you get 2 days off afterwards. You get 28 days off per year, 28 days off. Yeah, yeah.
Wow.
Some people,
That's a big difference.
yeah, yeah. One of my friends went and got married, and he spent 1 month outside the country, literally 1 month. He
Wow.
went and got married. He spent 1 month. So I think lifestyle is more
Much
relaxed in the
better in
UK.
the UK. So like, before you continue, do you have a what they say the week hour restriction? Do you have that, and how many hours is that?
Yes, I think from what I know, I mean, I don't have the number on top of my head. I'll send you the number later on, but I think all contracts that you sign is 40 hours a week.
Or zero. In the UK, in the US, it's 80, so 80,
Yeah.
almost double.
Double,
Double.
almost double. Yeah, yeah. So
Okay. So
my
that,
contract is
and I
40.
think that's an important point for people to think of or about, because when you are in mid school and you're very excited to get into residency and you like, I don't care, I will work 1,000 hours a week. But once you start residency, you realize that these are the prime years of your life. These are the 25 to
Yeah,
35, the years that you might have a relationship, get married, have children,
yeah,
enjoy your life.
yeah.
So people start to realize different things in residency. So for people who are young and in their early 20s and they're starting to think about your future, just think about all these options that you have, because yes, you might get here maybe 100 or $200,000 difference a year, but is it worth struggling, not sleeping for so many days, working double the hours? So just there are advantages and disadvantages. I definitely agree that there are advantages and disadvantages of each country. So you have to decide what is best for you.
Exactly. It's you need to know what you want in life. Do you want to work and be a high achiever, and do you want the financial part, or you're big on family? So it's and this is what nice about these residencies. Like they you know what you want in life, and then you pursue it. So it's not like there's a set thing. The UK is a different system. It prioritizes like life work balance is better. The US, the balance is not brilliant, but the money is more. So it's a good choice to have between both.
What about the attending lifestyle? What happens after you graduate?
So after you finish your training, you become an attendee, or in a UK term, it's a consultant. So most of the consultants work like 4 or 5 days a week from 9 to 5. So it's and they have their weekends off basically. And sometimes they do on calls, but they are on call from home. Unless you're an emergency consultant, then you obviously you have to be on site. Or if you're an interventionist, as a cardiologist, if you want to do PCIs and things, you are at home, but they call you, they say, oh, you need to come. But most of the consultants, it's 9 to 5 job basically, and then you enjoy your weekends.
Wow, that is life.
So
that is life.
yeah, and you can, if you're not happy with your salary, you can always like there is room for extra hours. I mean, if you're working 5 days a week, 9 to 5, I mean, you can take some Saturdays and Sundays. Some specialties you do on calls like once every 2 months or once every month, but that's compared to the US.
I'm also for surgery, or this is solely internal medicine?
I'm talking about on medicine. Some surgeons, if sometimes some of them are available on site, but some of them are available over the phone, and you can come in if you want to. But most of the consultants in the UK, they are available over the phone. There are some exceptions like emergency medicine and things that you need to be there. But if you're a plastic surgeon, if you're a dermatologist, if you're even a GI surgeon, you're at home literally. And they call you, if you have an emergency laparotomy, they call you, they bring you in. But obviously from center to center, it's different. But it's most of the consultants, they're happy with their lifestyle. I think the only thing, sometimes the money is not that high, but everyone is comfortable with their life as a consultant in the UK.
Well, I always tell students who ask me, you don't need to buy a boat, you don't need to buy a plane, just rent it for a week for whenever you want to have fun, right?
That's fair. That's a fair point.
Yeah. So I'm done with my questions, and I want to leave now the floor to you. Do you have any other things that I missed that you think students should know? Any final advice? Just tell whatever you think is important now.
I think it's really nice. It's really nice to see that the UK is getting attention nowadays. I think all the attention was shifted to the US which is completely deserved. But I think people should look at other options as well, and not because some people the US might not meant to be. So I think every medical student, they really need to ask the question, what do I want in life? Because the US is very intense in things, and but the UK is another valid option. So I think people should actually can choose and not only focus on one country. I think this is the advice that I would say to other people as well. It's a very nice lifestyle. It's a small country. You can literally travel whenever you want in one day. You don't have to take planes or anything. Lifestyle is better. The pay is similar, but like I said, as an attendee, it's different. But then, the lifestyle is much different as well between the US and the UK. So I think the UK is a very good option for people who prioritize quality of life over intense work hours.
Well, that was an amazing discussion. I think we covered all the points. that anyone could think of. But if we forget anything, you can leave them in the comments below, and we'll make sure to answer these questions to the best that we can. I would like to thank you so much, Brahim, for your time and for all this valuable advice and constructive discussion about how to get residency in the UK. Thank you so much for being on the channel.
You're welcome. You're welcome. Thank you so much.
For our viewers, if you have any questions, again, leave them in the comments below, or reach out to me on Instagram or Twitter at Malik Assad, or my Facebook page, Malik Assad MD. If you need to know more about residency in the UK and how to start, also reach out to us and we'll try to find the best way to help you with that. If you need to learn about research, statistics, make sure to check out my research course, my statistics course, which provide you all the details that you need to know to start your research journey. Thank you everyone so much for your attention, and see you in future videos.